Hey guys, it's me, Professor D, and welcome back to my YouTube channel. On this video, I'm going to be doing the most. You see this glitter? You see that? No, let me stop. I have some new followers. Let me behave. Okay, so on this video, I'm going to be covering pharmacology, okay? Specifically, I'm going to be covering mental health medications, schizophrenia, anxiety, bipolar disorder, and depression, okay? If you haven't done so already, guys, please don't forget to like and subscribe below. Don't forget, I'm also on TikTok, I'm on Instagram, I'm on Facebook, of course, here at YouTube. Don't forget to check out my lessons that are available on my website, nexusnursinginstitute.com. Very soon, I will have study guides for your exams. Okay, so watch out for that, and don't forget to check out my podcast for both nursing students and nurse practitioner students. My handle remains the same across every social media platform, and that is Nexus Nursing. So guys, without any further ado, let's get started. The client with major depressive disorder is taking selective serotonin reuptake inhibitor, SSRI, fluoxetine, Prozac, calls the psychiatric clinic and reports feeling confused and restless and having an elevated temperature. Which action should the psychiatric nurse take? 1, determine if the client has flu-like symptoms. 2, instruct the client to stop taking the SSRI. 3, recommend the client take the medication at night. Or 4, explain that these are expected side effects. And guys, the correct answer is 2. Instruct the client to stop taking the SSRI. Okay, so first things first. If you've been following me for any amount of time, you know I always tell you, when it comes to psych meds, patients never stop taking these medications abruptly, ever, right? We always want to wean them off. Well, the exception to this rule, guys, is a situation like this where we're suspecting what? Serotonin syndrome. Why would we suspect serotonin syndrome? Well, first of all, in the question, they tell you the patient's taking an SSRI. Hello, it's right there in this question. What is an SSRI? Selective what? Serotonin uptake inhibitor. So whenever a patient's taking an SSRI, now mind you guys, we love SSRIs. Those are our first line class of medications for depression, right? So we love them. However, they do have adverse effects that we have to be watching out for. And on top of that list is the serotonin syndrome. Look at those signs and symptoms: confusion, restlessness, elevated temperature. Other side effects that you would see, guys, would be your hypertension and your ataxia and the patient having tremors. All of those are signs and symptoms of serotonin syndrome. That is a medical emergency. That patient can die from serotonin syndrome. So in that situation, you need that patient to stop taking that SSRI immediately, because the last thing we need is the patient's blood level of that serotonin to be even higher. Okay? Now let's look at our other choices. 1, determine if the client has flu-like symptoms. We don't care if the client has flu-like, well, we do care. However, that's not a priority. What they're looking for you, what they're looking from you in this question is, do you understand what's happening in the situation? Do you understand that this patient is most likely experiencing serotonin syndrome, and do you understand that this is a priority? Okay, so we're not going to ask for flu-like symptoms, because flu-like symptoms are not signs and symptoms of serotonin syndrome. Therefore, that's not our priority at this time. Next question. Next choice, excuse me. Choice 3, recommend the client take the medication at night. What does that have to do with serotonin syndrome? Absolutely not. We need that patient to stop taking the med. Or 4, explain that these are expected side effects. No, they are not. Matter of fact, they're the opposite. Those are adverse effects. What are adverse effects? Side effects that may happen, but we do not want to happen. Then we tell the patient, if this happens, to notify us immediately, because we have some type of intervention that we have to do. In this situation, stop taking that medication and come see the doctor right away. All right, guys, next question. The client diagnosed with major depressive disorder asked the nurse, why did my psychiatrist prescribe an SSRI medication rather than one of the other types of antidepressants? Which statement by the nurse would be most appropriate? 1, probably it is a medication that your insurance will pay for. 2, you should ask your psychiatrist why the SSRI was ordered. 3, SSRIs have fewer side effects than the other classifications. Or 4, SSRI medications work faster than the other medications. And guys, the correct answer is 3. SSRIs have fewer side effects than other classifications. And that's exactly why SSRIs are our first line treatment class of medications when it comes to depression. That's exactly why. Now let's look at the wrong answer choices. 1, probably it is because of medication that your insurance will pay for. That's never going to be your answer. And let me explain this to you guys. When you're testing, it's a perfect world. We don't care about money. We don't care about staff. We don't care about resources. We don't care about equipment. And we don't care about time. We have enough of it. Some situations we care about time if it's emergency, but generally speaking, those 5 things we're not concerned about. We have enough to do what we need to do for our patient. It's not like the real world where money is a factor. You know, one drug may be the best class. That's the best thing to give the patient, but they can't afford it. So we give them something else, right? That's the real world. But in the book world where you're testing, it's a perfect world. So that's never going to be the answer. Choice 2, you should ask your psychiatrist why the SSRI was ordered. You never pass the buck. Never. When you're reading these test questions, the one that says, go ask somebody else, that is not your answer unless they're asking you which one's the wrong answer choice, which one needs further, teaching or further addressment. That's it, okay? You never pass the buck. And the last choice, the SSRI medication works faster. No, it does. Let me tell you something. Across the board, these psych medications all take several weeks before the patient will have a therapeutic effect, okay? So regardless of the type of psych med we're talking about, the minimum amount of time it could take for this medication to have a therapeutic level in the patient's bloodstream is going to be 2 weeks. And that's the minimum amount of time. Usually it takes about 4 to 6 weeks, but the minimum is 2. All right. But they all take about the same amount of time. There's not one that works faster than the other. So guys, your correct answer choice would be number 3. Next question. The client diagnosed with depression is prescribed phenelzine, Nardil, an MAOI inhibitor. Which statement by the client indicates to the nurse that the medication teaching is effective? 1, I'm taking the herb ginseng to help my attention span. 2, I drink extra fluids, especially coffee and iced tea. 3, I'm eating 3 well-balanced meals a day. 4, at a family cookout, I had chicken instead of a hot dog. And the correct answer is 4. That patient that decided to eat chicken instead of a hot dog. Why? What are we concerned about? Tyramine. Patients who are taking MAOIs, they cannot have anything that has tyramine in it. And guys, hot dogs, bologna, pepperoni, those sandwich or deli meats are high in tyramine. So the patient cannot have that. What else should the patient avoid? Yogurt, beer, red wine, the list goes on. Basically, let me tell you something. If a patient's on MAOIs, they can't have almost anything. Seriously, that list is so long, especially when it comes to other medications. Okay, so this patient should not be taking anything over the counter or any herbs because MAOIs counteract with so many other medications, foods, drinks, no caffeine, by the way. All right. So the fact that the patient realizes they can't have the hot dog because of tyramine, so they had chicken instead, that shows the teaching has been effective. So let's look at our other answer choices. We have 1. I'm taking the herb. Let's stop there right there. Did I not tell you no herbs or over-the-counter medications? So we're getting rid of that. 2, I'm drink extra fluids, comma, everything after that comma is wrong, especially coffee and iced tea. Coffee and iced tea has what? Caffeine. Patients taking MAOIs need to stay away from caffeine. And one of the things that MAOI does as a side effect, it can cause insomnia. You think this patient needs any caffeine anyway? Absolutely not. Choice 3, I'm eating 3 well-balanced meals a day. Well, I mean, that's great, but what does that have to do with teaching in regards to the MAOI? No. What's correct is 4. That patient understands they must stay away from any foods containing tyramine. Guys, by the way, for the MAOIs, you have to know the list of foods. I promise. If you're in the nursing program right now and you're in psych, or you're studying pharmacology and you guys are in the psych chapter, I promise you, look at me in my eyeball when I tell you this. I promise you, I guarantee you, you will have at least one question on MAOIs and foods that the patient has to avoid. So make sure you look at that list and you know them well. Okay, next question. The client with major depressive disorder is suicidal. The client was prescribed the tricyclic antidepressant imipramine tofranil 3 weeks ago. Which priority intervention should the nurse implement? I should wear my glasses, shouldn't I? I hate wearing them, but I need to. 1, determine if the client has a plan to commit suicide. 2, assess the client sleeping better at night. 3, ask the family if the client still wants to kill himself or herself. Or 4, observe the client for signs of wanting to commit suicide. And guys, the correct answer is 1, determine if the client has a plan to commit suicide. So we have a patient who is, the diagnosis is major depressive disorder, and they've been given a TCA 3 weeks ago. Remember I told you, these psych meds, they take about 4 to 6 weeks before the patient gets therapeutic level, but 2 weeks can be the minimum. So we want to see if the med has started working yet. What is the first thing we're going to find out? If they're suicidal. How do we find out if they're suicidal? We ask them directly, do you have thoughts or plans of harming or killing yourself? That is the first thing you ask. But when you look on the list, it's not on the list. Guys, this is where your critical thinking comes in. The perfect answer that we know is the perfect answer is nowhere on their list. So what's next? Okay, well, after I ask the patient if they're suicidal or if they're having thoughts of killing themselves and they say yes, what is the second thing I ask them? I find out if they have a plan. How do you plan on killing yourself? Why am I asking them if they have a plan? I'm trying to find out, 1, how lethal their plan is, and 2, how realistic their plan is. Are they really serious about killing themselves? Because if my patient who lives in Florida and I'm asking them how they plan on murdering themselves, they say, yeah, I'm gonna jump off the highest mountain, and we're right here in Florida, and you know, you're in the psych unit, I'm still gonna be concerned, but I know that plan's not that lethal as a patient that says, I'm going to stab myself in the jugular vein with the knife that I used to cut my steak every night I hid under my bed. That plan is much more lethal. That's why, number 1, you always ask, do you have plans of harming yourself or thoughts of harming yourself? And you ask that patient directly. Students tend to think that you shouldn't ask directly because you'll put that thought in their head. No, you won't. If they're not suicidal, you won't be putting that thought in their head. Usually, people who are suicidal don't really want to kill themselves, but no one's ever asked them directly. And so they've never been able to ask for help. So you ask them directly. If they say they're suicidal, the next thing is you find out about the plan. What is their plan? And if they have a plan, do they have access to whatever means they plan on killing themselves? And that's your number 1 right now, right there. Determine if the client has a plan to commit suicide. And so that's your answer. And guys, that's how you answer these test questions. You're not always going to see the perfect answer. Look for the next best. Okay, next question. The client with major depressive disorder has been taking amitriptyline Elavil, a TCA, for more than a year. The client tells a psychiatric nurse that the client wants to quit taking the antidepressant. Which intervention is most important for the nurse to discuss with the client? 1, ask questions to determine if the client is still depressed. 2, ask the client why he or she wants to stop taking the med. 3, tell the client to notify the doctor before stopping the med. Or 4, explain the importance of tapering off the medication. And it's 4. How many times have you heard me already say in this one video that we do not stop meds abruptly, except in a very, 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 very minute percent of situations such as, serotonin syndrome. But generally speaking, we don't stop meds abruptly. Patient has to be tapered off. And if you look in the question, this patient's been taking these psych meds for more than a year. Would you want to just stop abruptly? Absolutely not. What do you think is going to happen when you have that patient stop that medication abruptly? What's going to happen is that patient is going to have something that's called a rebound effect. Okay, so the patients, oh, they're sad, they're down, they take a medication, they start feeling better, and then all of a sudden we stop that medication abruptly. They're going to have a rebound effect where they may be irritable, they may have sleepiness, increased sleepiness, so they'll be driving the car and all of a sudden they may swerve on the road, right? So we don't ever want to stop those medications abruptly except in extenuating circumstances where their life is in danger, such as serotonin syndrome. Okay, next question. Which statement indicates the client diagnosed with bipolar disorder who's taking lithium and anti-mania medication understands the medication teaching? One, I'll monitor my daily lithium level. Two, I'll make sure I do not get hydrated. Three, I need to taper the dose if I quit taking it. Or four, I need to take the medication on an empty stomach. And guys, the correct answer is 2. I will make sure I do not get dehydrated. And that is absolutely, that's absolutely the truth. And let me explain to you why. Whenever you guys get test question with lithium, there are a couple things that need to be going in the back of your mind. Number one is your lithium level. You guys absolutely must know your lithium level, right? So your lithium level is 0.6 to 1.2. That is your therapeutic level. 0.6 to 1.2. However, if it becomes higher than 1.5, that patient is now in lithium toxicity, which is a big problem. And one of the things that can cause lithium toxicity is dehydration or hyponatremia. If that patient's sodium level becomes too low, that can cause a patient to go into lithium toxicity. So that's another lab value that you absolutely must know, your sodium level, which is 135 to 145, by the way, if you guys don't know, okay? So number 2, that is the correct answer. Dehydration can absolutely cause lithium toxicity. Let's look at the wrong answer choices. 1, I will monitor my daily lithium levels. The levels aren't monitored daily, depending on the facility the patient is. It's going to be monitored periodically, but it's not going to be daily because it's done by, it's blood drawn. It's not going to be daily, and the patient's not going to be monitoring it. It's going to be the staff, the healthcare professionals. 3, I need to taper the dose. If I quit taking it, you never stop taking that medication abruptly. 4, I need to take the medication on an empty stomach. No, you better not, because lithium, another thing about lithium is that it causes gastric irritation. Okay, it's very irritating to the mucosal lining of the stomach. So in order to counteract those effects, and so the patient doesn't get, the tummy ache or an ulcer, you teach the patient to take the lithium with food. Never take it on an empty stomach because of the gastric irritability. The nurse is preparing to administer lithium and anti-mania medication to a client diagnosed with bipolar disorder. The lithium level is 1.4. Which action should the nurse implement? 1, administer the medication. 2, hold the medication. 3, notify the healthcare provider. Or 4, verify the lithium level. And guys, the correct answer is 1, administer the medication. Why? Well, think about what I just told you. The therapeutic level is what? 0.6 to 1.2. That's the therapeutic level. But the patient isn't in toxic levels until they pass what? That 1.5. So the fact that the patient's in 1.4, yes, it's higher than the therapeutic level, right? But it hasn't reached that threshold for toxicity. It's lower than the toxic level. So we are going to give it, because this patient may have, other comorbidities. They may have other psych issues going on with them that the doctor had to give a higher dosage than what the recommended therapeutic level is, but they're not in toxic level. So you absolutely are going to go ahead and administer that medication. To which client should the nurse question administering lithium and anti-mania medication? 1, a 54-year-old on a 4-gram sodium diet. 2, 23-year-old taking antidepressant medication. 3, 42-year-old taking a loop diuretic. Or 4, 30-year-old client with urine output of 40 milliliters per hour. And everyone should get this correct. This is your critical thinking, guys. The correct answer is 3. 42-year-old client taking a loop diuretic. Why? What do loop diuretics do? They make you what? Urinate, right? You're urinating. That can cause the patient to go into what? Dehydration, because they're losing fluids. What does dehydration cause? Lithium toxicity. So that's your answer, guys. Now let's look at our other choices. Excuse me. 1, 54-year-old on a 4-gram sodium diet. Well, that's good because we know if the patient's taking lithium, we do not want their salt level to be too low, right? Because that can cause toxicity. And we don't want it to be too high. Let me talk to you about the other end, guys. When a patient's sodium is too low, it can cause toxicity. But when it's too high, it can do the opposite. It can cause the patient to have a subtherapeutic level of lithium, and that medication will not be as effective as planned, okay? Choice 2, the 23-year-old client taking antidepressant medication. There's nothing wrong with that. Matter of fact, many patients that are diagnosed with bipolar disorder, they also have a component of depression. So they will be treated for the depression as well. Okay, so that's not out of the ordinary. Excuse me. Nothing wrong with that. And choice 4, 30-year-old with a urine output of 40 milliliters per hour. Well, what's wrong with that? We want a minimum urine output of 30 milliliters per hour. And here the patient's at 40. So that's of no concern to us. So the problem is going to be that patient that's on a diuretic. We're worried about that patient and their electrolytes, specifically what? The sodium. It'll mess with the lithium levels. And you guys don't forget, lithium has a very narrow therapeutic range. It's that 0.6 to 1.2. But once that patient's higher than 1.5, they're at what? Toxic levels. Client with bipolar disorders taking lithium and anti-mania medication has a lithium level of 3.1. Which treatment would the nurse expect the healthcare provider to prescribe? 1, no treatment because this is within the therapeutic range. 2, IV therapy with an 18-gauge angiocath. 3, preparation for immediate hemodialysis. Or 4, the antidote for lithium toxicity. And guys, the answer is 3. Dialysis. We got to get all that lithium out of their blood. I just told you a million times that the lithium level is what? 0.6 to 1.2. Once that patient has surpassed 1.5, they're at what? Toxicity. This patient had 3.1. So we're going to have to do dialysis for this patient just so we can get that lithium out of their bloodstream. Let's look at our other answer choices. 1, no treatment because it's within normal range. No, it's not. We know it's not. Choice number 2, really? What is IV therapy going to do for that patient? No. Choice number 4, the antidote for lithium what's the antidote for lithium toxicity? Because if one's been invented, I didn't know about it yet. I just learned something new. There is no such thing. There's no antidote for lithium toxicity. Patient's going to get dialysis to get that lithium removed from their bloodstream. A client admitted to the psych unit diagnosed with schizophrenia is prescribed Clozapine, Clozaril for an atypical antipsychotic. Which lab data should the nurse evaluate? 1, client's Clozapine therapeutic level. 2, client's WBC count. 3, client's RBC count. Or 4, client's arterial blood gases. And guys, the correct answer is 2, the client's WBC count. Okay, so we're talking about antipsychotics. What are we concerned about now? Agranulocytosis. That's why we're looking at the WBCs. Okay, agranulocytosis can put this patient in extreme risk for getting some type of infection because of the decreased immunity. That's why we're looking at the WBCs. Look, are the other choices? Choice number 1, the client's Clozapine level. There's no such thing. It doesn't exist. Choice number 2. RBCs, this medication does not affect the RBC count. Excuse me, I'm sorry. And 4, arterial blood gases. This medication doesn't affect the respiratory system. What it can affect is those WBCs. It can significantly decrease them. We're going to be watching out for agranulocytosis. The client admitted to the psych unit experiencing hallucinations and delusions is prescribed risperidone, an atypical antipsychotic. Which intervention should the nurse implement? 1, provide the client with a low tyramine diet. 2, assess the client's respiration for a full minute. 3, instruct the client to change position slowly. Or 4, monitor the client's INO. And guys, the correct answer is 3, instruct the client to change position slowly. Something else you need to know about these antipsychotics, they can cause orthostatic hypotension. You don't want that patient to fall. You don't want their blood pressure to suddenly drop. So you're going to teach them to change positions slowly. That is the correct answer. Something else you got to remember about these antipsychotic, they can cause patients to have, dizziness, lightheadedness, and that also places them at a risk for falling. Safety is a big issue when the patients are taking antipsychotics. Okay. Next question. Oh, let me go over the wrong answer choices for you. So 1, provide the client with a low tyramine diet. Do you guys remember which drug class we got to watch out for the tyramines? MAOIs, not antipsychotic. MAOIs are what? A type of antidepressant. Antipsychotics are drugs for patients who are out of touch with reality. They're either seeing things that are not there or they're hearing things that are not there, okay? That's what antipsychotics are for, patients who are out of touch with reality. 2, assess the client's respirations for 1 full minute. There's no reason for that. The antipsychotics don't have an effect on the respiratory system. Choice 4, monitor the client's INO. Antipsychotics don't have an effect on their kidneys, generally speaking. Now, if the patient takes an overdose of them and they make their kidneys shut down, that's something else. But, a normal therapeutic level doesn't affect the kidney, so that would not be the answer. But it can cause, like I said, orthostatic hypotension, dizziness, lightheadedness. So we want the patient to be safe. The client with schizophrenia is prescribed Clozapine, Clozaril, an antipsychotic, an atypical antipsychotic. Guys, I can't speak. Which information should the nurse discuss with the client concerning this medication? 1, discuss the need for regular exercise. 2, instruct the client to monitor for weight loss. 3, tell the client to take the medication with food. Or 4, explain to the client the need to decrease alcohol intake. And the correct answer is 1, discuss the need for regular exercise. Something else you guys need to know about this class of medication. It can cause the patient to gain a lot of weight. And I'm not just talking about a couple pounds. I'm talking about a significant amount of weight. So it's very important to teach that patient that in advance, okay? Wrong answer choices. Choice 2 says instruct the client to monitor for weight loss. No, they need to monitor for weight gain because that medication has the tendency to make the patients gain a lot of weight. Choice 3, tell the client to take the medication with food. It's not necessary. These antipsychotics don't cause gastric upset. Choice 4, explain to the client the need to decrease. Look how they try to trick you. To decrease alcohol intake. Did any of you guys fall for that? I hope not. I don't care what type of psych med a patient's on, whether it's an antidepressant, whether it's a bipolar medication, whether, it's anti-schizophrenic medication, anti-mania, whatever. It's psych meds, patients never drink alcohol at all. So we're not going to tell them to decrease the alcohol. We're going to tell them to avoid the alcohol, to stay away from alcohol. They cannot have a drop of alcohol while they're on these psych meds. You see how they tried to trick you? Decreasing is not enough. They need to avoid alcohol completely. The nurse is discussing the prescribed antipsychotic medication with a family member of a client diagnosed with schizophrenia. Which information should the nurse discuss with the family member? 1, explain the need for the family member to give the client the medication. 2, encourage the family member to learn CPR. 3, discuss the need for the client to participate in a community support group. Or 4, teach the family member what to do in case the client has a seizure. And the correct answer is 4. Teach the family member what to do in case the client has a seizure. And here's the thing, guys, it doesn't matter if the patient has a history of seizures or not. Antipsychotic medications lower the threshold for seizures. So whether that patient has a history of seizures or not, if they're taking an antipsychotic medication, there's a chance of them having a seizure. So you have to teach the family members what to do if that patient has a seizure, okay? Let's look at the wrong answer choices. 1, explain the need for the family member to give the client the medication. Why? What's wrong with the client that they can't take their own medication? We don't promote patients to be dependent on anyone. The only time we'll do this is if the patient has a condition where they can't take the medication themselves, and that's not the situation. Choice 2, encourage the family member to learn CPR. Antipsychotic medications are not known to stop the patient's heart. I mean, it's great if the family learns CPR, but that's not our priority teaching, such as a seizure is. Choice 3, discuss the need for the client to participate in a community support group. It's not the patient that needs the support group. It's the family that needs the support group. And if you guys are taking psych right now, you're going to start learning about this. It's not easy being a loved one or family member of a patient that has a disorder such as schizophrenia. Okay, so it's very important when this patient has schizophrenia that you teach the family members, their loved ones, their support system, that they need to join a support group. And in the support group, they learn how to cope with the disorder of the loved one. They learn how to deal with it. They learn how not to be an enabler, right? They learn so many skills that will help support them, support the patient. All right, next question. The client diagnosed with paranoid schizophrenia has been taking Haldol, a conventional antipsychotic, for several years. What statement indicates the client need for additional teaching concerning this medication? 1, I know that if I have any rigidity or tremors, I must call my doctor. 2, I eat high fiber foods and drink extra water during the day. 3, I am more susceptible to colds and flu when taking this medication. Or 4, this medication will make my hallucinations and delusions go away. And the correct answer is 3, I'm more susceptible to colds and flu when taking this medication. So if a patient's taking an antipsychotic, why would they be more susceptible to colds and flus? Agranulocytosis. That's why. Antipsychotics have the potential of causing those WBCs to become severely low to the point that this patient's immunocompromised. Okay? Let's look at the wrong answer choices. Well, the right answer choice is what the patient understands, and that's why we didn't choose it as the answer. 1, I know that if I have rigidity or tremors, I must call my physician. Absolutely. Why? Those are extrapyramidal side effects that we need to be notified of, and the doctor will most likely decrease the dosage of that medication or switch that patient over or do some type of bridge therapy. Choice 2, I eat high fiber foods and drink extra water during the day. Absolutely. Because antipsychotics, one of the side effects of antipsychotics is causing an anticholinergic effect. If you guys have watched my YouTube video on anticholinergics, you remember what anticholinergics do? Remember anticholinergics? Can't see, can't spit, can't pee, can't, right? Yeah. So the antipsychotics, because they mimic the anticholinergic, the patient's at risk for what? Constipation. Okay. So that's good. And choice 4, this medication will make my hallucinations and delusions go away. Yeah, that's what antipsychotics are supposed to do. When a patient is psychotic, the definition of being psychotic means that you are no longer in touch with reality, right? So when a patient takes an antipsychotic, what does that do? Help bring them back in touch with reality. So it makes those delusions and hallucinations go away. And guys, delusions and hallucinations are not the same thing, so don't use them interchangeably. Hallucinations are, seeing, hearing, tasting things that are not real, okay? It's the senses that are not real. What are delusions? Delusions are false belief. The patient believes something that's not true despite evidence of the contrary. For example, a patient that believes that, I don't know, a patient that believes that they're God. And they broke their leg or they hurt themselves. So you're saying to them, okay, well, you can't be God. You're hurt. You have evidence, but they still don't want to believe. They truly believe in their heart that irrational belief. That is what delusional is. Okay, so there's a difference. Okay, next question. A client diagnosed with general anxiety disorder is prescribed alprazolam, Xanax, a benzodiazepine. Which information should the clinic nurse discuss with the client? 1, explain to the client that this is medication for short-term use. 2, inform the client that rage and excitement are expected side effects. 3, tell the client to avoid foods that are high in vitamin K. Or 4, instruct the client to take the medication with at least 8 ounces of water. And the correct answer is 1, explain to the client that this medication is for short-term use. And let me tell you why it's for short-term use. Benzos are known to be abused, okay? If they're highly addictive, patient can get dependency on them. That's why they're only used for short term to decrease the risk of the patient becoming dependent on this type of drug class. Wrong answer choices. Number 2, inform the client that rage and excitement are expected side effects. No, they're not. They're actually paradoxical side effects. What does that word paradoxical mean? That means opposite. So opposite effect, right? So that's because if a patient's taking Xanax, if I'm nervous and I'm taking Xanax, what's Xanax supposed to do? It's supposed to calm me down, right? If it doesn't calm me down, it gives me the opposite, rage and excitement. Those are opposite effect. That's what paradoxical effects are. The female client taking lorazepam Ativan, a benzodiazepine for panic attacks, tells the nurse that she's trying to get pregnant. Which action should the nurse take first? 1, tell the client to inform the OB of taking Ativan. 2, instruct the client to quit taking the medication. 3, determine how long the client's been taking the medication. Or 4, encourage a client to stop taking Ativan prior to getting pregnant. And guys, the correct answer is 3, determine how long the client's been taking this medication. Determine is another word for what? Assess. Find out. Get information. We need to know how long this patient's been taking this medication, because that is going to dictate how the doctor is going to decide to get this patient off of this medication. We do not want this medication in the patient's bloodstream if they're pregnant, because it's going to have an adverse effect on the fetus. Okay? All right, guys, we are down to our very last question. The nurse is preparing to administer the benzodiazepine alprazolam Xanax to a client who has generalized anxiety disorder. Which intervention should the nurse implement prior to administering the medication? 1, assess the client's apical pulse. 2, assess the client's respiratory rate. 3, assess the client's anxiety level. Or 4, assess the client's blood pressure. Okay, guys, and the correct answer is going to be to assess the client's respiratory rate. I just told you that this medication does what? Bring everything down, right? So if that patient's respiration is less than 12, are you going to give them that medication? Absolutely not. You're going to withhold it, right? You don't want it to go any lower. And guys, I hope that you found this video to be helpful. And if you guys want to see more pharmacology covered, please just let me know and I'll do that for you. For those who are in the nursing program right now and you're taking psych, I have an entire playlist of mental health and psychiatric disorders. So make sure you guys check out my psych playlist. Please, guys, I get so many emails from you telling me, you passed your boards and I helped you so much. You're so appreciative. Guys, the best way that you can show me your appreciation, the best way you can support my channel is to do 2 things. Number 1, like and subscribe below. Like this video. Subscribe to my channel if you haven't done so already. And 2, share my video. Share my video. I'm trying to grow, guys. I'm at like 25,000, which when I hit 25,000, I didn't know what to do with myself. But guys, I know I have the potential. I know I can do better. I want to see those numbers growing. So please help me reach more nursing students like you. Share my content. Share it on your social media. Share it with your instructor. Maybe your instructor can share it with the class. That's the 2 ways you can support this channel. Don't forget, guys, I have my coffee tumblers available on my website where I go over priority patient, blood type compatibility, and important words when you're studying, and you see those words to pay attention to, because that topic most likely will be on your exam that you're studying for. So check that out. Also, I have my audio lessons on my website, nexusnursinginstitute.com. I have study guides coming soon for you on that website as well. Don't forget to check me out on TikTok, Facebook, Instagram, and also my podcast, guys. I'm on every major streaming platform. My handle is the same, Nexus Nursing. I'll see you on my next video.